staff coming from AHS.
And
Secretary Samuelson, are you and Rich?
yes,
The full contingent. Okay, so we're live now.
we are now live. Yes, thank you.
So this is Senate Appropriations. We voted out the BAA yesterday afternoon, and now we're back focusing on the big bill for FY 2023. And we're taking testimony from the Secretary of Human Services and Chief Fiscal Officer for the agency. I'm sorry, Rich, I'm probably butchering your title, who are here to give us an overview of the agency budget request. Thank you. It's all yours.
Thank you, Madam Chair. I appreciate yours and the rest of the committee's time today. I'm going to, if it's okay, go through an overview at a high level, and then I'm going to pass it off to our CFO, Rich Donahue, to walk through each of the individual department-specific budgets in more detail. To start off with, I'm hoping.
Do you need screen sharing?
I can do screen sharing. Rich, do you want to share your screen?
Yes, I can certainly do that.
Okay.
And
If not, Chrissy can do it, but
I think we've got it.
and I know that you have a hard stop at 2:30. So whenever we get through, we respect your time for, your schedule, and if needed, we'll have you back.
Rich, were you able to share?
yes, you are not able to see the presentation at the moment.
We didn't.
No, we can now. It's come up.
Okay.
Okay. So I'm going to drop this in a slide show view so you can see it. So what you can see overall is the Agency of Human Services has included in the governor's budget an 8.4% increase in the general fund portion. This really falls into a couple of key categories. The first are the typical position costs, and I'll walk through the increases there. It also includes a backfill for COVID-related one-time investments from last year. So last year, the Department of Corrections had access to $15 million in federal funds that were used to backfill some of the base. And so this year you're seeing that coming back into the budget. There's also
Secretary Samuelson, it seems like our use of those CRF dollars, particularly in corrections, by having to backfill is contributing to what seems to be a very large general fund increase, when reality is that some of it is just replacing with general fund, which was understandable. And then we used those for one time. What would be the overall increase adjusting for the swapping out of federal funds for this, the corona relief revenues for the general fund?
For corrections, it's $15 million. But Rich, do you have any additional pieces to add there?
Would the 8.4 drop down to 5, or I'm just wondering.
I understand your question, and I can get you that statistic in just a moment.
Okay, because it really distorts your increase. It appears like that's all new additional money, when in fact all it is taking out that swapping.
Right, absolutely. So Rich, I'll let you get that, and Madam Chair,
just keep going. Okay. Mm-hmm.
Okay, so in addition to that, this past year at the federal level, they discontinued the redetermination for Medicaid. We also saw, because of the pandemic, pretty significant swings in utilization. And so you'll see a cost pressure there in reaction to that. I'm going to walk through a couple of key initiatives that are proposed in this year's budget in a little more detail. Here are some, this gives a basic list of what those are, but I'll go through them in more detail in a moment. For the Agency of Human Services, directly related to staffing, we have the current staff is 3,668, which represents a 3.6% increase. Overall, that's 126 positions, but it should be noted that the majority of those positions are directly in response to the COVID pandemic and are limited services positions at either the Department of Health or the Department of Children, Families, and the Economic Services Division, again, directly related to the COVID response. So moving on for the overall highlights in the budget, for the Department of Children and Families, you see $14.2 million general fund increase. You'll see Mr. Donahue will go through this in much more detail, but it's in four main areas. First is investments in the Family First Prevention Act. The second is a 5% increase to the foster care rates and an increase in the respite care funding. And then for the Child Financial Assistance Program, which serves children up to age 13 or those with disabilities up to age 19, it's a movement from the 50th to the 75th percentile. It also includes an expansion of the after-school and enrichment programs for those students who qualify for the Child Care Financial Assistance Program. Moving forward to Dale and DMH. There's a $7 million general fund increase, which encompasses a 3% rate increase for our designated agencies and social service agencies, and also our assisted care community service providers and home and community-based service providers. So this is a broad swath across our provider systems. In addition to that, there's an investment of $8 million at the Department of Health, which expands substance use treatment and prevention services. And then an additional $4.2 million in order for us to continue to address our needs in our mental health service system, particularly with a focus of expanding the mobile response program to an additional 4 communities and our suicide prevention efforts, both of which are critical, particularly based on the mental health concerns that we're seeing following the pandemic. And then lastly, there is a $951,000 investment at DIVA for expansion of their postpartum program, which provides eligibility for enrollment previously up to 2 months and moving now up to 12 months postpartum.
Mm-hmm. We have the language about doing a state plan amendment in the budget adjustment. I want to get into when the departments come in, but I'm a little surprised, 7 million just rate increase for the delivery system that's been underfunded and 8 million for SUD. Most of many individuals with substance use disorder actually have co-occurring and are being served by the DAs. And so it seems it seems rather interesting. We just need to see the interplay and the extent to which the 2 different investments are going in. The designated agencies and the SSAs are requesting a 10% increase.
Mm-hmm.
And this is 3, but it seems like you can't look at the 7 in isolation with the 8.
Right. Agreed. I think, Senator Kitchell, that one of the things that you point out clearly is a focus for the agency is continuing to evaluate our mental health needs, but also ensuring that we work around co-occurring. So really, how can we integrate both of those systems as we go forward? You'll see us begin to evaluate and put forward proposals related to that. I want to pause. I see another hand up.
Oh, I don't see anybody.
I do. Senator Sears.
Yes,
Thank
I
you.
recognize your voice, Senator.
Oh, thank you. I want to echo the comments of the chair, but add to that. I don't see this, the 14.2 million and other investments as being enough. I believe we have a system of care in crisis.
Mm-hmm.
And just from what I'm hearing, for example, from people in foster care and others in trying to even get people to do these jobs. We have a crisis. I know that we have a crisis in placement options for kids, whether they be under DMH or under DCF or even some under Dale. And I don't think these investments are going to really solve that crisis. I'm really worried that we're not taking this crisis as seriously as I think we need to. So while I appreciate that we're putting this money in, I don't think it gets near the scope of the problem. So
I
I
guess
just
we'll
want to be
have
on
a
record with
lot.
that. Yeah, I'm
and-
sure we'll have a lot more discussion,
Yeah.
but I
Mhm.
just think this is unrealistic to expect people. I mean, I just heard from somebody whose job is to recruit foster parents, and how almost impossible it is for them
Mhm.
to do that other than kinship care.
Yeah, no, it's a tremendous challenge. And of course, we've had so much emphasis on certainly childcare programs, but foster care, 24/7 of these children, and the payments are really, you're not doing it because it gets you a great financial reward. So I will have obviously a lot more discussion, particularly as it relates to placement options, and also the Families First Prevention Act and what that provides. So that will be a topic, I guess, topics for when the commissioners come in. Other questions on this slide? Otherwise, we'll just roll on. Oh, Senator Westman, sorry.
So my question was, in the breakdown of this, because I know the CCFAP, the CCFAP money is about $5 million. So of the 14, how much is going for foster care rate? And because I suspect the after-school programs and CCFAP is probably at least half of that 14.
Yeah, so as we move into the next couple of slides, we'll get a detailed breakdown for each one of these. If I may, I wonder if it would be okay, Senator Westman, to answer that question when we get to that detailed slide.
It's fine, but I wouldn't have asked the question, but I think it might highlight what the question that Senator Sears just raised.
Yeah, absolutely.
Please go to the next slide then, and maybe it will help. And otherwise, we'll have to get into more detailed discussion when we have the commissioners come in to understand this.
We'll move on to the next slide. It may be worth, Senator Kitchell, as the commissioners come in, there are kind of two questions that might be important to ask. One are the investments that we've made into the mental health system of care over the last year, including those that we've talked about related to the BAA with the stabilization funds and the retention recruitment funds. There was also a $2 million investment in the past year into retention and recruitment just to the designated agencies, $8.8 million of healthcare stabilization. Last year, there was a 3% increase also in the rates. We've moved some of the retreat to a value-based payment model, and then another $13.2 million in relate to the system. As we look forward, it would probably be beneficial to ask DMH about the Certified Community Behavioral Health Centers program, which will allow us to leverage federal funds into the state for designated agencies along with accountability.
Yeah, and I understand they're seeing if in fact they could do a statewide application through Vermont Care Partners.
Correct. And the Integration Council is also taking a look at how to integrate the mental health and substance use work with our physical health work in order to reduce duplication and improve holistic care. So a couple of things as the departments to come in to ask. Also in the budget this year, there are a few additional one-time investments, one of which is included a $2 million, and these are one-time, not base, $2 million GF. For our nursing loan repayment program that's administered through the AHAC system. And then a $3 million GHAP investment for the Department of Health scholarship program through VSAC. There's also a $45 million SRF funds proposal out of DCF, Office of Economic Opportunity for Weatherization, which is intended for low-income homeowners to do no-cost comprehensive weatherizations, which might include heat pumps, upgrades to wood stoves, and others. So that's the general overview of the budget. At this point, I'm going to turn it over to Mr. Donahue so we can begin to go through kind of in detail, department by department.
Thank you.
Could I, just a second, Rich? Chrissy, we have a meeting on the AHEC and I just realized, I don't think I put it on my calendar. Is it the 4th?
The meeting is scheduled, yes, for Friday, the 4th,
Okay.
after the floor.
All right. Thank you. The AHEC system, which is funded by a large part by HRSA, the state plan is due. And so they're trying to look at how to make sure that we're maximizing the benefits of that area health education center resource as it relates to pipeline and getting students into health careers. So sorry, but I just realized I might have scheduled a meeting that I didn't know. So I'm sorry, Rich, go right ahead now.
Oh, not at all.
So, Madam Chair, may I ask a question?
Yes.
Could we back up to the last screen? Madam Secretary, I would just say to you that there's been some concern on our committee, and it's been in our committee for a while. While I appreciate the effort that you're putting into loan repayment and scholarships for nursing, we're chasing after very few placements in the pipeline. And the initiative is all directed at the same way that most other states are doing. And the real question for me is, how are we increasing the pipeline and more placements in educational institutions to get out more nurses and create more placements for nurses when there's not enough placements in the school to keep up with the need?
Yeah. I think that's the workforce development plan that our Director of Healthcare Reform has some overview, Senator Westman, of that. I don't have it in front of me. I think Ina Backus would probably be a good opportunity to talk through what that kind of comprehensive plan looks like, including some of what we've presented here, but also kind of that pipeline.
Okay. Well, we can keep going, but certainly our concern is, if we're competing for an inadequate supply, that doesn't do anything to address the underlying problem, which is we've got to start educating and graduating more nurses to meet the demand. And we have that study from several years ago that showed how significant that was. On the other hand, I don't think we can lose sight of the fact that nursing isn't the only area where there's shortage of healthcare professionals. Child psychiatrists, for example, are very, very scarce to a number of other professions. So what we're trying to do is, how do we expand the supply, not just using the same old techniques to see if we can attract someone. And the research, I know, is now that it's in place, we can't take it back, because everybody's going to say, what are your loan or your repayment policies? But the research would suggest that those aren't the most effective strategies to deal with workforce shortage. So that's a longer discussion than we're going to have today, but that's just to let you know, that's something that we just really are going to keep hammering at. And that is, how do we grow our programs? How do we bring more students in? How do we grow that section of the workforce and not just simply throw more incentives out there that don't deal with the fact that you don't have enough supply, and that's driving up cost.
But isn't that the instructors that we need?
It's not only instructors, you need that instructors are really key to expanding the classroom capacity, but it's also the placements, the clinical placements that have to be part of any of the curriculum, and so that and part of the training, and so the development of those clinical placements have got to be done. Just as there's no point in having more students in the classroom if you don't have the clinical placements for them to actually meet the qualifications or the standards. So it's got to be looked at both ways.
Yeah.
So I'm sorry, Secretary Samuelson, we'll keep going through because your time is precious and it's 2:14.
Yeah, absolutely. And I'm glad to hear the deep grasp that this committee has of the issue that's the workforce issue, which is quite complex. So thank you for your support of that, and also for the fact that it's not just nursing, but also our mental health workforce. Rich, you want to take it from here?
Certainly. First, if I may, Madam Chair, I want to answer a few of the previous questions that were raised. You asked what the general fund increase year over year was after accounting for the $15 million backfill of CRF at DOC, and that's approximately 6.9%. There is a large increase associated with the Medicaid consensus utilization and caseload projections as well that contributes to the general fund increase, as I know that you are and committee members are well aware of. Also, you had asked about the $7 million general fund investment in 3% rate increases for DAs and SSAs relative to $8 million at VDH for substance use disorder related investments. The $7 million, as you are well aware, for the 3% rate increase would be grossed up. So that's closer to $15 million gross. The $8 million investment at VDH is general fund, and they can testify as to the specifics of those proposals. And then,
All right.
Senator, I'm sorry, go ahead, please.
No, I said, all right.
Okay.
Thank you for that information.
You're welcome. And then Senator Westman had asked about CCFAP rate adjustments. Correct, approximately $5 million of general fund is associated with the CCFAP rate adjustment, and close to $500,000 for the foster care rate increase, as well as the investment in increased respite. So then I will return to the slide deck here just very quickly. The pie graph on the left shows $1.1 billion in general funds. This includes the general fund for the global commitment appropriation, which comprises 54% of general fund for the agency. The pie chart on the right deduplicates global commitment matching funds and shows a 1% overall cost for the Secretary's office relative to the agency. And if there aren't any questions on this slide, I will proceed.
Okay, I don't see any or any voices, so we'll keep going.
Okay, and I will, I think, move past the salary fringe, retirement, and ISF increases that you and committee members are probably aware of, and focus on the other points if that is okay with you, Madam Chair.
Yeah, I would just like to know salary and fringe for state employees. What percentage increase is that?
So the major driver of that increase would be inclusive of the retirement rate change, which was several percentage points associated with pension fund contributions. I would need to get back to you, though, with an exact statistic for the salary and fringe increase.
All right.
And I'm
I can understand that. Thank you.
Okay, you're welcome. There was a base FMAP change down in 23 versus fiscal year 22, 56 to 55.98. And then there was also a CHIP qualifying claims adjustment associated with the overall increase of $51.2 million in general funds, which includes the matching funds for global commitment gross expenditures across the state. The downs in the Secretary's office comprise $16.8 million There was the one-time use of general funds for consensus, as Secretary Samuelson had previously testified to. There's also new adult caseload utilization associated with the decrease because of the enhanced FMAP associated with that portion of Medicaid rolls. We're transferring the 211 contract to DCF. This was a BAA item. And there is an enhanced FMAP match rate for mobile response for the one of the proposed initiatives at DMH.
Is that a time-limited enhanced match?
My understanding is that that would be at the time, for the time being, an ongoing enhanced rate.
Okay. Oh, that's good.
And if there aren't any questions, I'll proceed to the next slide.
Mm-hmm.
So for DEVA, again, summarizing salary, fringe, retirement, internal service funds, those are contributing factors to the $36.8 million increase. The Medicaid consensus forecast is a large contributor to the increases at DEVA. There are also the fully funded increases associated with the buy-in and clawback, and the annual rate adjustments for participating Medicaid providers in the state of Vermont, inclusive of two initiatives that we wanted to highlight: the 3% rate increase for ACCS providers and expanding postpartum coverage from 60 days currently to 1 year.
Mm-hmm.
And then there's just a relatively small amount of decreases in general fund associated with FMAP adjustments.
I thought the FMAP went down, so why isn't that an up?
That is a net change associated with FMAP adjustments across all of DEVA's appropriations, including state only and non-waiver matched funding.
Oh, all right, thank you.
You're welcome. And I'll move on to VDH if there aren't any questions regarding DEVA's slide.
I don't hear any, so
Okay.
we'll move on.
So again, there is salary, fringe, retirement, internal service funds. The meat of the proposal here, so to speak, for VDH is approximately $8 million in increased general fund use for substance use disorder expansion. That includes investments in expanding the prevention coalition across the state of Vermont, increasing capacity for residential treatment and recovery services, as well as enhanced employment services for those receiving substance use disorder related treatment. The downs in VDH are largely personal services adjustments across funding sources and operating expense adjustments that results in a total decrease of $384,000 in general fund. And are there any questions on the VDH slide?
No, I don't see any, so I think not. We'll keep going.
Okay. Moving on to DMH. So the salary and fringe increase at DMH does include the request of 15 new positions. The funding is included in the base budget request for DMH, but the additional positions are necessary specific to the secure residential facility.
The one in Essex that we brought online?
Correct. And then moving through the retirement internal service funds items, just wanted
Rich,
to...
I have a question. Yes. You need 15 new ones. So are you, this facility is going to be, I can't remember, is larger than the temporary one in Middlesex?
That is correct. My understanding is that it's both capacity and also the inability for positions to be shared in co-locations that are much closer geographically currently than they will be in the future with the permanent secure residential facility. But I defer to DMH, and I'm sure they can answer in greater detail than I can.
All right, thanks.
You're welcome. I also wanted to highlight an increase in secure residential operating costs. This is above and beyond the funding that was made available for the capital investments and improvements in building the facility. An increase in UV MMC contract costs, as well as DMH's specific initiatives, which includes the 3% rate increase for DAs and SSAs, mobile response expansion, as well as suicide prevention expansion, which includes a position request. The downs are net neutral for a net effect of $0. I'm going to pause there in case there are any questions.
I don't think so. I'm sure we'll have lots when the commissioner comes in.
Okay. Then I will proceed to DCF. Again, quickly moving through salary, fringe, retirement, and ISFs. There are also cross-fund adjustments associated with the positions at DCF and how those positions earn their funds, so to speak. There is also an increase for subsidized adoption and substitute care caseload and utilization adjustments. This is an annualization of the trends that were testified to as part of budget adjustment, as well as a change to the targeted case management rate at DCF, which is a cost allocation related rate. And that shifts funding away from federal funds into the general fund. This was also testified to in budget adjustment. That leaves remaining the initiatives at DCF, including the Family First Prevention Services Act, which will allow DCF to more fully leverage Title IV funds, but requires more state matching funds in order to do so. Foster care rate increase of 5% and respite expansion. That was approximately the $500,000 general fund increase that I mentioned earlier. There is a CCFAP rate increase, bringing that standard to the 75th percentile of federal standards, as Secretary Samuelson had previously testified to, as well as an increase in provider allowances for closed days and vacation days. And then there is also an investment in the increase for after-school and enrichment programs funding for those children who are currently CCFAP eligible. Then in terms of the downs, there's $6.4 million in general fund decreases. Again, there are revenue adjustments between federal funds and state funds, where federal funds could be more fully leveraged, and elimination of the NFI contract for FSD case aids. The current permanent staff available in district offices in DCF's estimation no longer necessitates the need for contracted case aids in the district offices. And then there is caseload savings in Reach Up, as well as the elimination of the medical review team process in the Reach Up program. And I'm going to pause there in case there are any questions.
I don't see anything. I'm sure we'll want to get into the detail when Commissioner Brown comes in.
Okay, very good. So moving on to Dale, there is the annualization of the current CBA with AFSCME workers. There are the annual DS and traumatic brain injury caseload adjustments that you all are well familiar with, as well as statutory nursing home rate increases and home and community-based services caseload adjustments. There are also 3 sets of expanded services proposed in the governor's recommended budget, inclusive of associated position requests. Long-term care oversight expansion, which includes a request for 6 positions. The adult protection investigators requiring 2 additional positions, and an additional need for the Office of the Public Guardian, which is a 2-position request. And then, of course, Dale also includes a 3% rate increase proposed for DAs, SSAs, and HCBS providers.
So for the personal care that's done under that are negotiated, the contract, the collective bargaining, what
Yes.
would be that salary increase that has been negotiated for 23?
So if I remember correctly, Madam Chair, the current CBA, the annualization in 23 under the current terms would be the greater of 2.25% over the current negotiated rate or 25 cents over the statutory minimum wage. And right now, I believe the hourly rate on average is $12.80 under the current collective bargaining agreement.
And Rich, it's currently in bargaining, is that correct?
That is correct.
Yep, so those are last year's numbers.
Thank you on that.
And this is an annualization of those currently executed numbers. In terms of downs, there are $2.5 million in general fund decreases, which are associated with nursing home bed day utilization, as well as developmental services budget to actuals realignment.
But the nursing home utilization and the savings there are kept within choices for care,
That's correct.
right? As reinvestment. Although that utilization has been so distorted by the fact that nursing homes haven't been able to accept patients because of staffing limitations and individuals ending up, in hospitals for prolonged periods. So I'm just wondering how you adjust for that reality. Obviously, it's influenced utilization, but it's not a desirable situation long term.
Understood. And I think that's information that Commissioner White and her team would be able to provide in greater detail to you and your committee. That decrease is based on the last 12 months of data as of the time that we were developing the budget, which does include current trends, but that is what current trends indicated.
I don't have any question about that. I'm just saying, I think they're terribly distorted because of the staffing problems. But utilization is down. That's true. Now we're into DOC. Senator Sears, this is your area.
So again, quickly moving through salary, fringe, retirement, internal service funds, and operating increases. There's the backfill of CRF for base general funds that we previously discussed. And there is a new position requested for constituency services. In terms of the decreases in general fund totaling $4.7 million,
Could you just tell me constituency services? Who is a constituency here? Inmates, families, communities? Could you just tell? I don't have a sense of that. Maybe Senator Sears does.
If Senator Sears doesn't have anything to add, I would defer to Commissioner Demmel and his team to provide more information for you regarding that request. Unless Secretary Samuelson, you would have anything to add to that.
Well,
I would refer to Commissioner Demmel. I do know that a major component of that are the families and other individuals related to our individuals who are currently incarcerated. But I think Commissioner Demmel can speak more to what that looks like.
One thing that is very helpful, because sometimes we get into situations where there's a request for a new position or new funding. And so you must have a white paper in order to have had the governor agree to put this in his budget. So if there are just even brief summaries about say this new position, what this new position would do, it's just very helpful in making us feel that we're informed. We put in money for vaccine incentives, and then I was told, well, what those incentive are, giving students parties, and it's like, well, how would we know that? So if they're when the departments come in, if you could just ask them if there's something new or anything that would help us sort of describe what that, what constituent services would mean and how it would contribute, and how would we know that what the benefits would be from that investment.
Understood. We will communicate that to the departments to be prepared for that.
Mhm.
I'm sorry.
Oh,
I
here's,
missed the
this one looks
question.
very familiar. Move the community high school of Vermont to the ed fund.
Yes.
Mhm.
Yes, so that is
Mhm.
among the decreased pressures in general fund as proposed for 23, as well as operating expense savings and a reduction to out-of-state caseload.
But
And that's the last slide. I'll pause there.
I do have a question about that. Excuse me for trying to eat my lunch while. If you're saving money on reductions out of state caseload, that's supposed to go into justice reinvestment.
Well, maybe that's where they're putting it. We'll have to find out.
So,
Well, it looks down 4.7 million. I believe that. I don't know what the operating expense savings, but the reduction, and I'm really worried about that particular line, that it's a down. So
But I thought it was be analogous to what we had with nursing home utilization, and and the answer was that would stay within the choices for care corral. So I think probably we need to make sure that that's happening here with the out-of-state caseload.
so the language that maintains out-of-state caseload savings for reinvested purposes is current law in the 22 enacted budget. Until there would be similar language in 23, that would not be the case. That is not
that's outrageous.
Well, then we must have, that's our fault, because the intent was to make
No.
that an ongoing commitment of funding source to support the reinvestments. So if we didn't write it that way, it's 1-year session law. That was not our intent. So I guess we're going to have to put that on our list to
No,
correct.
the administration has known this all along. I find this outrageous, frankly. The administration was involved in justice reinvestment too. The administration agreed to all these. To now tell us that you're gonna, you've already put it into your budget, means that we've got to find the funding somewhere else. Well, I suggest you guys go back and find it. I am really upset with this because you knew what our intent was. You, the administration, was involved every step of the way. To now suggest that you're not going to reinvest those funds is quite, I don't know what the proper word is. I'm so incensed. So just be aware of that right now, that this is a violation of what was agreed to suggest that that was our fault is absolute BS.
I was only saying if the language was not done properly, then I guess we need to fix it. We will also need to know what the breakout is in terms of the reduction here, because the community high school for months probably almost half of the savings. So we need to understand exactly the specific amount that is being generated here for the out-of-state caseload.
Well, but they've already made their, yeah.
Well,
Thank
it's
you,
true.
Senator.
We're going to have to go in and identify it, and then we'll have to figure out. Well, we'll have to get greater understanding, and I think the commissioner needs to be prepared to give us more specific understanding,
Well,
and also where we can get how we restore that money for the purposes that we always has intended it to be used. I think if this is the last slide, we could perhaps bring down the screen sharing, and so we can see everyone. Okay, so I would like to see Senator Sears, because I know this is an area he feels passionately about. We thought we had made very clear about our policy to reinvest and to strengthen that community side and reduce our reliance on incarceration.
I would like to add, if I may, Madam Chair, Senator Sears, I in no way intended to imply that there was a shortcoming by the legislature or an oversight by the legislature on this front.
Appreciate that, but the fact is that this is something that in January of this year, we received our reports. Everybody was under the impression that it would be a consistent use of those funds to reinvest what you save. We weren't as good in after the 2010 Justice Reinvestment first one, where we went from 750 out of state to about 250. And we didn't reinvest the money, and we're paying for it now. So this was an effort to try to recapture some of those monies so that we could have community-based programs that would reduce recidivism and end up saving money in the long run. If you figure out what it would have cost today if we hadn't done Justice Reinvestment 1 and you had 750 people out of state, what would the cost be to the state? And I suggest that that's a huge amount that's been saved. And if you don't reinvest it, this isn't going to work. We saw the increases coming back at us. That's why we did Justice Reinvestment 2. I realized now we have a new corrections commissioner, a new secretary of administration, a new secretary of AHS, and perhaps it got lost in the transfer of new people. But this is extremely important that we keep the promise that was made. And I just I'm really find this to be unacceptable by the administration. And it's something that I hope you will adjust in your projections and find someplace else to cut. Thank you.
All right, I think we have certainly expressed the concern around that. And I'm sure you will alert the commissioner. I think the other thing that we're really looking at, and that is the survey that was done in terms of the Springfield facility and the findings there. And certainly one area is that our programming within the facilities, our own operated facilities, is really inadequate. There's so much extra time, opportunities to engage in programs and so forth are really very, very limited. And so that's another area that certainly want to discuss and understand what the action plan will be as we move forward on that as well. So anything more on corrections? I realize, I'm sorry, it's past 2:30, Secretary. So you do need, your hard stop ended 12 minutes ago. So
okay.
I'm sorry about that.
Well, appreciate your time today.
Okay, so unless there are any further questions of the Secretary, or Rich, are you staying for the Commissioner's presentation? You're welcome to, but thank you very much, Secretary Samuelson, and we will, if we need more testimony, we'll be in touch. So thank you.
Have a good afternoon.
Okay. So now we have a familiar face for some of us. And I know, Senator Starr, you said you had to leave. So we're going to move into DCF, and we have here the commissioner. And if you want to introduce your staff to the rest of the committee and then run through your presentation, that would be great.
Yes, thank you, and good afternoon to everyone. For the record, Sean Brown, Commissioner for the Vermont Department for Children and Families. And with me today, I have our interim Chief Financial Officer, Megan Smeaton, and the Senior Advisor to the Commissioner, Katerina Lasias. And so we'll be walking you through our proposed 23 budget and answering your questions. And then anything we're not able to provide today, we will certainly follow up and provide to the committee following our testimony. Katerina, if you could pull up the PowerPoint, and we'll jump right in. And I think as customary, we'll touch on some of the high level like salary and fringe, but then move on from those and focus more on the substantive ups and downs in our budget, if that works for the committee.
Yes, yeah, and the ups and downs, we really just want the highlights. Sometimes they're very modest changes, and so we don't need to go line by line.
Sure.
We leave that up, the House will, certainly do a much more detailed review probably than we're able to do with just the afternoon committee.
Sure. So starting with our budget, we're proposing a budget just under $480 million for the Department for Children and Families. That's an increase of $36 million from the 22 budget as passed in our current year budget. And so moving on to the next slide and some of the highlights that we'll touch on as we're going through our budget. We've talked about it in the BAA, the grants and contracts restructure, and the 211 contract moving over, but we'll just move beyond those. We are proposing an elimination of the medical review process within the Reach Up program, which results in some savings. And then there's also a bill in the House that removes that language from statute requiring that process, and we'll talk more about that. Also, we're proposing some investments in the Family Services Division, implementing the Families First Prevention Services Act, and we'll talk about that in detail. And then also some increased support for foster parents in terms of rate increases and increase the amount of respite care available to foster parents as well. Also, we're proposing a rate increase in the CCFAP program, as well as expanding opportunity for school-age kids for after-school and summer care. Also, just highlighting, that the federal government did increase the base benefit in the SNAP program by about 25%, and how it impacts our budget is the cash out that we're able to piece of the program that we administer here in Vermont, and then also we'll talk about the Reach Up caseload and where it's at right now, where we project it to be in 23. And then here's just a highlight. We will focus on this long, but just some of the work that we've done and will continue to do throughout the pandemic in our different areas. There's been a lot of work that's happened across the agency to support the Vermonters we serve in our programs with increased state and federal funding and stimulus dollars. And so a lot of work has gone on. And I just wanted to recognize that and highlight it for the committee here. And then moving on to the admin portion of our budget. Some of these were in the BAA, and we won't focus on those and just the Pay Act and retirement. The one thing I did want to touch on, we're proposing a statutory change, and there's a bill in the House, but it's also in the budget of eliminating the medical review process in the department. So in this, in the Reach Up program, if a participating household is seeking a medical deferment from the work requirement and program participation, there's a process for them to seek a medical exemption, and they work with their treating provider to submit the request and the supporting information. And then under the current framework of the statute, we contract with independent medical doctors to review that and determine whether they support it or want to modify it or whatnot. And what we're finding through that process is that our doctors on this process that we contract with agree almost universally with the treating physician's recommendation, and we move forward with that. And so given it is a process that requires more of treating physicians and families and creates delay and normally does not result in a different outcome, we no longer see the value in this process for the program or the participants, and are looking to eliminate it and change the statute so we can just rely on the treating physician's recommendation and move forward with that in the program.
There is a bill in the House to do that.
Yes, there is. Katerina, do you have the number of that bill? I can't recall.
Well, I know that there are two bills in the House related to Reach Up. And I think one is related to training, and I guess maybe the other is this medical review.
Yes, yes.
I'm getting the bill number right now. In addition to the medical review team, it also allows 2 parent households to both enter into post-secondary education. Right now, the rules have it so only one parent can access post-secondary, so the bill would accomplish both of those.
All right,
Um,
so the numbers are H464 and H672.
It's H464.
Yes, that's what I thought I said.
Yes,
There are 2 bills.
You mentioned 2, so I was saying the one.
Yeah, okay.
Yeah.
The H464 is the medical review.
Yeah.
Okay, and you support that because you feel that it is adding no value, that the treating physician assessment is generally accepted without question. So it's just an administrative step that doesn't really yield much value.
Correct.
But if you're going to take the money, so okay, well, I'm just thinking, do we even need a separate bill? Can't we just do language in the budget? Because we're generating the savings based on changing that. Just something to think about.
Yeah, point well taken. Okay. Moving on to the Family Services Division budget. There are some, just in the BAA, we are consolidating how we utilize temps in the division, and you saw us truing up our spending in the BAA, and you continue to see that here with temp staffing. As a part of that, we're now going to rely on in-house state temp positions to do this work. We have a contract with an agency to provide some contracted case aides, and you know, with the staffing challenges, there's vacancies and having a hard time filling those positions, and it's easier for us to manage if we're doing it in-house and doing it with all state temps. And so that's the proposal here, eliminating the contract, and we're going to continue to just use state temps to meet the need. Also, as you saw in the BAA, you have a sub-adopt caseload adjustment based on, you know, the number of kids that are needing subsidized adoptions, and also the services they're receiving. Also, you'll see an 7.6% up on the foster care caseload, and some of that is due to cost we're seeing for some of the kids in our out-of-state placement. Those programs are starting to comply with the Families First Prevention Services Act, and so their costs are going up, and those are coming back to us. And then also just the demographics of the foster, that the caseload of substitute care is always changing, and this is based on a cost per case, but not necessarily an overall caseload increase. Our caseloads are staying fairly constant right now. We're not seeing a large uptick nor a decrease in the caseload right now. The other thing I want to spend some time on with the committee we're proposing a $3.5 million investment in the Family Services Division regarding the Families First Services Prevention Act, and we'll focus on that in a little bit. But I also wanted to highlight that we're proposing in a 5% increase in foster parent rates. You know, they've done an amazing work during the pandemic, and we want to recognize that work. And also, just with the cost of inflation and increase in cost, we want to make sure we're staying ahead of that and providing some financial relief to our foster parents. And then also, just given the pandemic and what we're seeing, the impact on our kids and having higher level of need, and you know, our foster parents are doing an amazing job. We also want to increase the amount of respite that we're able to provide to a foster families, so if they need a break, so that with this increase that we're proposing, they'd be able to access respite care once a quarter, which is an increase. And if you look at the foster parent rate increases, you know, the 5% increase is about $375,000, and the respite care is about $220,000 of that increase you see here on the chart. And then the next just kind of highlights our caseload right now, staying fairly constant through the pandemic right here. And then moving on to the Families First Prevention Services Act. this is where I want to spend a little bit of time with the committee and just walk them through the proposed investments that we're
So,
making.
Madam Chair,
Yes,
I'm gonna come back to that. I'm gonna need to better understand those numbers when we sit down, Sean and I sit down with the department. I get, you got a 5-point-something% increase for foster care, but the caseload's up 7-point-something%. So I'm trying to, if your caseload's going up in is that overall dollar amount? Or are you increasing what you're paying per case? So the increase more than makes up for the increased caseload.
Yeah, so the foster parent increase of 375,000, we're happy to go into more detail, Senator Westman.
Yes.
That's actually the daily reimbursement that we provide to foster parents for taking care of our kids.
It's going up.
Yes. Oh, so we're going to pay them a higher rate. So they're going to, foster parents are going to earn more money.
That's what I'm trying to figure out, because your last sheet talks about an increase in caseload too. So I'm just trying to make sure.
Sure. Yep.
there's an increase in the subsidized caseload. Is there an increase in the number of children in custody?
No, it's more of the demographics and the needs of those kids and their ages.
That's what I'm wondering. So it
yes,
isn't,
yeah.
it's not because you got more, necessarily more children in custody. It's the kind of the composition or the characteristics and.
Exactly.
Okay.
Yes. Yep. Yep. And
Well, I'm very interested in this because everybody's talking about 4E and all the potential that it provides, and some of it is more. And certainly, I'm glad to see judicial master on here because I think we're starting to get some experience with that approach that came out of the CHIN's work group recommendation, and so the thought was that might actually help within the justice within the court system. And I believe they're judicial masters. I don't know. I know there's maybe several that have just recently been brought on.
Yeah, there's one, I believe one judicial master sitting in
Okay.
up in the northwestern part of the state. And we're proposing an investment of $232,000 and change to work with the judiciary to bring on another judicial master. FFPSA requires a new set of hearings if we place a youth in residential care. Normally, there was only a hearing if it was going to be out of state. Now there's a hearing when you place any youth in residential care, and it needs to happen within a certain time frame, or we lose the ability to draw down 4E money to pay for that placement. It has to occur within, I think, several weeks of the placement. And so it's important that the judiciary have those resources and that we have access to those timely hearings to make sure we're maximizing 4E and getting those cases reviewed under the requirements of the FFPSA. And so that's the background for the judicial master.
So does it give you, it alters the financial structure? Can you tell us a bit more about what that does? And there's still 4B out there, but that's getting less and less all the time.
Did you say 4B?
In terms of the eligibility, isn't it 4B that you have to meet the old 4A standard?
Yeah, I'd have to look into that, Senator Kitchell. That's an area I don't have a lot of depth of knowledge on. And Megan, I didn't know if you had any.
I thought the number of children who could qualify under 4B was small and getting smaller.
Yeah. We can get more information for you on that, as a follow-up. The other increase here is we know that there are new requirements for our residential providers need to meet to become a qualified residential treatment provider and be eligible for 4E funding, like 24-hour nursing care and some other requirements. And we know that there will be additional cost to our providers to provide those services. And so we want to ensure that we have the resources because those costs will get wrapped into their rates. And so we expect we'll start seeing rate increases from our providers. And so we're looking for just under $1 million to make sure we can cover those rate increases so that they can comply with the FFPSA requirements for residential treatment programs. Also, we're able to implement evidence-based prevention services that have been identified and cleared to be out on the clearinghouse for states to access. One of those is motivational interviewing, and so we're proposing $1 million to implement this evidence-based model in Vermont. We're really looking at, it's called motivational interviewing, but really trying to enhance how we communicate and work with biological parents and foster parents and improve in our work and collaboration with them, with the hope that we'll develop better understanding of what the child's needs are, the biological parent's needs, hopefully leading to better case planning and implementation of services and leading to better outcomes for families and kids. And so we're projecting a cost of about $1 million to implement this prevention piece. Also, part of FFPSA, residential programs are now going to be required to provide aftercare to youth who are discharged from their program for up to 6 months. And obviously that type of follow-up and case management will require additional resources. And so we're projecting a cost of around $1.2 million to help to pay for providers to provide that care, with the hope that as youth transition out of residential and back into the community, that with the residential program following up and monitoring progress on their discharge planning and services that they coordinate, put in place, that it will lead to a better connection and making sure those services they believe that youth need to be successful are not only available, but being provided in the appropriate way that the discharge plan and coordinated case plan considered when that youth left the residential program. And so that's up for a 6-month period after a youth leaves residential. And so they just become a greater part of that team of professionals supporting that youth when they're back in the community.
So I'm just really struggling what 4E or what this Prevention Act does. You still have a match requirement or not?
Yes.
And what is the match rate?
Megan?
So without being in compliance with the FFPSA Act, we can't draw on any 4E, so it's zero.
Okay.
But if we implement all of these services, then we would be able to draw on 4E for kids that are eligible for 4E when they're placed in residential facilities. So this is our way of getting the state into a place where we can continue to utilize 4E for our.
But do you have to match the federal funds? That's my question.
Yes, there are general funds associated with every child that's placed in our system. But if we don't do these investments, those costs would be 100% GF. So
Okay.
by doing these investments,
I understand that, but we have different match rates, 90-10, 80-20 for VR. We have 50-50. We have child support 60-40. So that's what I'm asking. Is there a match rate? And Medicaid, is huge. What the state match rate is. So that's all I'm asking is what's the state match rate? And I know some of this is global commitment, which gets us into Medicaid, obviously. So the judicial master, is there any, that's all, the fund is general fund. Is there no 4E match for that?
Oh, okay. I think I misunderstood what you were asking. I thought you were talking about the kids themselves. You're talking about if we need federal funds to match the 232,430 for the judicial master. Is that the question?
Yeah. Mm-hmm. I'm asking is the 232 just the general fund share, or is that all general fund? And can that general fund draw down more 4E so that the 232 is, I don't know, whatever available federal match added to it?
So it's my understanding that the judicial master will be funded 100% with GF. And that, but that allows, like we had discussed, that allows us then to draw in the 4E for the children. But if you look on our ups downs, the judicial master is a GF, that 232 is all GF, and it's not leveraging a federal fund source in addition to the 232. So we're not saying that the judicial master, it costs, twice that, and we're only asking for the GF. That's the cost, and it's 100% GF.
So for services to children, 4E funding, is that 100% federal, or is there a required match for any of these 4E dollars?
So the in-state, so like the next line down, the 966,895, that one is 129,661 of GF, 20,982 of Fed Fund, and 816,252 of GC, of which, as you know, a large portion is the GF match on that.
I'm actually trying to find out where we experience the benefit of the 4E match or dollars funding. That's really, and I guess maybe I'm not artful in how I'm asking the question, but we have we have match rates in Medicaid, and those match rates vary depending on the subgroup of Medicaid beneficiaries. And I'm just wondering, for those 4E, you're saying you have to have requirements, you have to provide these services under this federal legislation. I'm just saying, well, where do I see those 4E dollars? Are they a capped entitlement? Or as long as you can find the money or you're meeting the requirements, you draw them down? I'm trying to see where they are here in the budget.
Senator Kitchell, it's the last part that you just said. Once we accomplish this part of the plan, we can then pull down Title 4E to be able to serve the children in residential care. So we need to accomplish this part of our prevention plan to be able to then draw down those federal funds. And I'm not sure if there is a match to those federal funds. We can follow up with you on that.
It's
All right,
the same.
that would be.
So Senator Kitchell, also, if I may, the total recommended budget in 23 for the Family Services Division is like 135,772,000 and change. Of that, approximately 32 million is federal funds, primarily all 4E. And so if we don't comply with the Families First Prevention Services Act, some of that funding is at risk. And because we won't be able to draw down 4E, and then those dollars then go into our admin, our staffing. And so we're at greater risk of putting more pressure on the general fund if we don't make these investments.
That's very helpful.
I would just add to that where you'll see this, and the 4E match is the same as the Medicaid match, but where you'll see the benefit is not in any of these, but in our substitute care budget line, because that's where we would be able to have that federal offset.
Okay, I guess I was just jumping ahead. That's all. All right. And so what they're requiring is the state to make all these investments first before you can draw down the 4E.
Correct. And if we didn't implement this, we would just then not be able to draw down as much 4E, and we would then have to replace it.
This is kind of this is somewhat unusual then, where the state has to make these investments before, because 4E has been out here for a very long time.
Yes, this is a significant piece of federal legislation that impacts this area, the most significant in quite a while. Really trying to get states to invest on the prevention side of it, so that they can reduce, hopefully, expenditures on some of the higher end systems of care that they support.
Is there a cap on 4E funding?
I can find that out for you. I think that if the kid is eligible, we can draw it in.
Yeah, I don't believe there's a cap, but we will confirm that.
All right.
And then we anticipate that we will have some ongoing training needs. And so we've asking for $100,000 to help training our staff and our partners. And then there's also, it was in our 22 budget, that there is also an independent review requirement for kids going into residential care. And so there's like 2 layers of review almost before kids go into residential care. And that highlights the family services budget. Moving on to the Child Development Division. Here we are proposing some new investments out, other than the Pay Act and the retirement, some technical adjustments. We really want to focus on governor's investment in early childhood and learning and families with young kids. We're proposing $4.9 million investment to move us from the 50th percentile of reimbursement of providers to 75th percentile. And what that means is currently at what we provide for a CCFAP rate in Vermont, families can afford to access 50% of the childcare providers or slots in the state based on what we pay and what those providers charge for rates. With this increase, families will be able to have greater access to childcare because they'll be able to afford 75% of the rates and providers in the state with the level and reimbursement. And that's what the federal recommended threshold is 75th percentile. So this gets us to that. We've been trying for several years to do that. Also included in that $4.9 million, we are also increasing the number of days a provider can be closed and get CCFAP reimbursement. Currently, we pay for 15 closed days for a provider, and this would increase us to 30 days. And then also we're increasing the number of vacation days a family can access and still have us pay for their slot. Currently, that's at 10 days, vacation days a year. And this proposal would increase that to 20 days a year. Yes.
I had one question, and I probably should know this. If a child is enrolled and eligible and getting a subsidy and is out for a week or whatever, because maybe the family is away or sick, is the child care provider paid for those hours of care for even though the child is not in receiving the child care service?
Currently only up to those 10 days a year for that
Okay.
family.
10 days. All right.
And that's one of the, under Act 71, some of the analysis the legislature's asked for is what would it look like if Vermont moved from an attendance-based to an enrollment-based reimbursement, which I think is to the heart of your question, Senator.
Well, it really is, because, for example, adult days are only getting paid for the hours that, the daily. And so if one of the participants is out sick for 3 days, they get nothing. Nursing homes have whole bed payment for a certain number of days. And so that's why I'm asking the question in terms of, so I assumed that there was some coverage, but I couldn't remember. It's sort of the hold slot. 10 days.
So,
okay.
and we recognize that, the work of 171 is moving forward, and those reports will be produced and they'll be reviewed by committees and decisions made. What we're really looking to do is outside of that and recognizing that, providers with the pandemic are experiencing conditions and families as well. And this really helps families immediately in 23 to what we're hearing and seeing from families and providers. This will just provide a little bit more level of financial reimbursement for those households and providers. And then moving on, we are also looking to expand the provider network and the opportunities available for after school and summer programming for school age kids. looking to expand who accepts CCFAP, for school age kids 6 to 13. And this really builds off some of the work we did last summer in Katerina. I didn't know if you want to go into a little more detail with that, but it's just under a $7 million investment.
You see, once we get the cannabis system up, those revenues from the sales tax are all devoted to after-school programming. Do you see that? Are you anticipating that funding? In other words, what it could? I mean, it's just trying to anticipate that funding relative to what you're being proposed here.
Yeah, I think we still, given we don't have experience as a state with the cannabis retail market yet and understand what level of revenues that will generate, I think we'd want to wait and see what that, I know that starts, I think, in the fall. So we might not have numbers available until.
No, I know it's more kind of anticipating another reference to support that.
Yeah.
I think, Madam Chair,
Yes.
I agree. We don't have the experience, and this was my question too. There is a cap of, I believe, 10 million on what you can realize from it. The 30% that is deeded to substance misuse prevention and after school. I'm not sure what the split is between substance prevention and after school, but so it would be some subset of 10 million.
Well, I thought the prevention was out of the excise tax, 30%. And then the sales tax goes into the ed fund for after school programs.
Oh, you may be right. No, that's right. So I'll have to look at that again, because I thought we had already dedicated 30% of the excise tax
To prevention.
to prevention. And so you're saying that the sales tax is deeded to after school?
I believe so.
Okay.
We'll double check, but that's true too.
Yeah, I think you're correct.
Okay.
Who,
But
me or
Yes,
what?
Jane, I
Oh.
think you're correct, Jane. I think
This was my-
that the governor wanted 30% into prevention of substance abuse because that was his program. And the prevention came out of the after school programs, I think, came out of that. Stephanie's going to check on it for us.
Yeah, okay. It's just an awful lot to keep track. And you do realize all of state government comes before this committee. So if you think it's hard to keep straight for your programs, you can imagine how much of a challenge it is for us to do it for so many different programs and funding streams.
Oh, absolutely.
We can keep going though on this. This is kind of a recap of your earlier slide.
Sure. And here I just wanted to touch on, these proposals are part of a bigger governor's initiative around supporting child care providers and families with young children. The governor's proposing in the budget an expansion of the child independent care credit to increase it to 50% of the federal credit for families seeking that credit in Vermont. Also, a child care worker income tax credit of $1,000 to help support the child care workforce. And then also to support providers as well, full exemption from the education property tax for pre-K providers in 23, and a partial refund for licensed child care providers in 24. And Commissioner Bolio certainly could go into much more detail. I think these are in his area, but I wanted to highlight them because it was all part of a package to support.
And we know the House is really looking at a different approach, and that's a child tax credit, refundable, which experience with the federal one had a very significant impact on child poverty rates. So Senator Nitka.
Just wondering, with regard to the exemption for the education property tax, is there a cap on how much that could be?
And I would defer to Commissioner Bolio on the details of that, Senator Nitka.
Okay.
And these are just proposals. Just keep that in mind. And I do think, as I said, the House, where the tax policies are going to start first, they're really interested in doing something different, and that is having a state-funded child tax credit, refundable credit.
Yes, and we've been working, it's a committee I don't go before often, but I have recently appeared on that topic in House Ways and Means, particularly the impact it could have on the benefits of families receiving that tax credit. And the program in particular that we have concern about would be the Three Squares Vermont program. It would be, if it was paid out monthly, it could count as income and reduce the Three Squares benefit. So we'd want, we're trying to determine if there's, the impact that could have. We believe we have flexibility in our other benefit programs, but given it's a 100% federally regulated benefit, that we have little flexibility there and count whether we count it or not as income. And so there could be an impact there for the families that receive it, where we would be giving them a state benefit and then they would lose 100% federal benefit. And I just wanted to highlight for this committee's thinking.
So, Madam Chair, may I?
Yes, I can't see you, but I know it's Senator Westman.
So, Sean, just to give people an idea of the overall, so that as the secretary came in, we talked about a budget increase in the overall for DCF of about 14 million. And what I see in this is the basically 5 million for CCFAP, and then nearly 7 million for after school and summer programs for schools for an increase. So of the 14 million in DCF, almost 12 million of it is CCFAP and after school and summer programs.
Yeah, and as we just reviewed, there's some investments in the Family Services Division as well, but there's also some downs as well in our budget in other areas.
But in the overall budget is going up a little over 14 million, and 12 of that that increase, not counting that I understand we have some downs that are going to. But of the overall 14, it's fair to say that 12 of the 14 is right here in CCFAP and after school and summer programs.
At a high level, you are correct, Senator. Yes.
So what is the total appropriation for childcare for CFAP?
Right now, the total proposed appropriation for child care for 23 is 100 and Megan, correct me if I'm wrong, as I'm reading the ups and downs, 116 million, almost 117 million.
That's the entire CDD budget.
Yep.
Is that the question? Or do you want the childcare, the CCFAP portion?
I was asking for the CFAP portion.
So I can get you the exact number. I think it's in the mid $55-56 million range.
Obviously, there's great advocacy. I don't think there's an program area that we get more emails. I have not gotten an email saying, why don't we do something for the state supplement to SSI, which benefits seniors, our poorest seniors and people with disability. It's interesting to think about the different programs, and that's a program you have. And I assume there's no recommendation to increase the state supplement to the SSI benefit. I've mentioned that before, Commissioner. And so I do think it's important to be clear that the money going into the child care program, and then in budget adjustment, we did another 6 million. And then there was also ARPA funded child care stabilization money. I think was another 29 million.
We're
something
issuing
like
now 29 million currently.
29 million. And I don't, and so it's hard to keep it all in place. And then there was a request, the House did not accept it, and we did not too. and that was that the 800 plus a bit, because the caseload was down compared to estimates, should have been kept within childcare. And I know that certainly we're hearing childcare is an important need in supporting families, but I think it's also important that people have an understanding of how much in total, in a cumulative way, has been devoted to trying to address the childcare needs of families and childcare providers. And this certainly is by moving, and these are ongoing. This isn't just stabilization. This is going to really help by moving this up to the 75%, and then for the additional payment for providers, because knowing they need to take a break and they need a vacation. And so this is making progress certainly in that area.
So I think it,
Yeah,
sorry, I was
sorry.
going to say that per your question, it's 56 million in BAA, and with these investments, we're up to 69.7 million for the CCFAP budget in bill.
Okay. That's very helpful to look at it in total. So shall we go on? It's almost 3:30, so I think we should just keep plugging away here.
Yes, and and we have actually been focusing on some of the most impacted areas where we'll see the most change in our budget. So it should move on a little quicker. There's no significant changes in the OCS budget, more of the salary and fringe and the changes there. AABD, Megan, we are seeing a small up just to make sure we're meeting the needs of the caseload of what we're projecting the caseload to be. And you are correct, we're not proposing an investment in this area center. And one of our concerns always is if, almost all of these households, or many of them, are on 3 Squares Vermont, and any investment we made here would count as income and impact some of those other benefit programs. So sometimes the families are no better off if we give here, it gets taken away here. And that's one of the, given it's a federal program, we don't control some of how income is treated in these programs. And that's one of the challenges we face when we're.
Well, we have the same thing with our reach up. If you increase reach up benefits.
Yeah. Yes.
There's a relationship, but it's least, it's for each $3 increase, it's a $1 reduction in food stamps. So you still end up $2 ahead.
Yeah. And then moving on, and then we just had some caseload data so you could see the caseload numbers. And I would point that out. We're seeing, here the AABD caseload's been steadily declining since 2015, and then some of the other data charts we have in our presentation, you will see similar trends in reach up and LIHEAP's very similar, and 3 Squares Vermont. And our caseloads, particularly now, are not reacting in a way that you would predict with the economic impacts we're seeing from the pandemic. In prior downturns, our caseloads followed a pretty predictable pattern of going up with the unemployment rate and the economic stress. And we're just not seeing that in our caseload. Our caseloads either are remaining stable or actually decreasing, like in the Reach Up program, which is just different than we've seen. And some of that's attributable to the significant amount of money that the federal government has sent directly to families, but also that we've been providing to families as well in some of our other programs. And then moving on, we are not looking for any increases in GA. The one area I wanted to touch on, if we particularly go to the next chart, Katerina, you can see, where we started the pandemic in 20 and then in 21, where you see our spending rise exponentially in emergency housing, and all of that increase so far has been covered by FEMA. That right now those dollars are predicted to expire at the end of March. They could be extended, or they could be extended at some sort of match rate. But we also have a significant amount of emergency rental assistance available to the state, well over several hundred millions of dollars. And we're, working with the GA work group right now, and, in the language in the BAA that we've been negotiating with the chairs of the appropriations committees about transitioning to those funds as soon as possible, but still being able to meet the needs of homeless Vermonters needing a hotel as a safe place to stay. We don't need those dollars appropriated in the budget. We have the ability, given we've been through the approval process, to seek the funding we need through ERAP, through excess receipts request. And Megan, I defer to you on explaining, that process a little bit more, but we have that available and we intend to use that. We also have about $38 million appropriated of ERAP already in our budget for the current year that we've not used, given the extensions of FEMA from September to December and December to March. We've not had to utilize those funds. So we currently will have the ERAP resources to meet the needs ongoing as soon as we transition to that new transitional rental assistance program we're working on right now with the target date of April 1st.
Okay. In some ways, we have our regular GA program, but it's been so distorted by all this additional money that has come in on the federal. So it's the language I think we put in the budget adjustment as it related to the transition to this federally funded ERAP program is in, and I hope you can work and get your emergency rules up, and but certainly the housing has been, in terms of your workload, it's got to have been an incredible workload to put all this together.
Yes, it has been.
Yeah.
Our team is tired. Our frontline staff and our program team, who's been working to keep adjusting our programs, and then our team on the ground who are administering it, trying to keep up with the pace of change. And
so, what is happening in your district offices?
So
are they open? I mean, in terms of COVID, are they? What is the current functioning of those those local offices?
Yes, our offices have remained open throughout the pandemic from start to current. We've maintained a staffing level there to meet the walk-in needs. Our walk-in, we certainly quickly modified our practices and procedures, and so that the majority of our staff could work remotely from home, and most of our eligibility work and communicating with households and families is over the phone. And so much of that work has shifted from in-person to the phone, but we still do experience a number of walk-ins across the state on any given day. And so we're maintaining our district office staffing to meet that needs, but also boosting the number of staff on the phones to meet the volume, calling our 800 number for services.
Okay. Any other, this is your final program to go through?
Yes.
I have a hotel question.
Yes.
If you could go back to that chart with the hotels on it. Thank you. You see pretty consistent November, December. I assume January would be about the same. We're looking at extending it until June 30th, right? In the Budget Adjustment Act. I'm just curious if there's any budget in 23 to continue the hotel payments.
That's what the ERAP is going to do. That can pay up to 18 months, I believe, of housing, and that would include the hotel rooms. Is that your question, Senator Sears? Or
well,
maybe
if I'm looking correctly at the numbers, trying to through the graph, it's $3 million a month. Am I reading that correctly?
You are, Senator, and it's
Yeah,
actually
so-
increased since that last line of December 21st. I think we're getting closer to the $5 million mark, between 4.5 and 5
Okay.
million. And what our goal, Senator, is that we will continue to draw down FEMA through the end of March to meet the need. And if it's available beyond that, we could still access it. But financially, for the state, we need to start utilizing the emergency rental assistance that Vermont has received. It's been I think over 300 million of emergency rental assistance. And if we do not start spending those dollars and spending them on hotels to house homeless families is an allowable expense, we would be at risk of returning 70 to 80 million dollars to the federal government of that emergency rental assistance. And then also, if we allocate a certain percentage of it, we hit a certain percentage of it, I think it's like 75% spent, we then can spend about 30 million of those rental dollars to actually build permanent housing. While we're still waiting for guidance from Treasury on what that looks like, the state does have the opportunity to leverage some of those rental assistance dollars to build permanent housing if we hit certain spending targets.
Great, thank you.
Yes.
And that's why we worked so hard to get the language that we put in the budget adjustment about, the transition and that interplay between FEMA and ERAP, because we really wanted to make sure that we were minimizing the risk of those funds being clawed back and jeopardizing access to that about 30 million for affordable housing.
Does security come out of that 3 million?
Given it's a rental assistance program, we cannot directly pay for like case management and security services, Senator. But with some creative program design, what's included in the rent payment is what's included in the rent payment. And so we're creating some programs where services and security costs may be rolled into the rent payment, and then we would have the hotel be the reimbursement mechanism. And so we're working out those details now, where we might have the ability as a state to be creative in that way. And so we're working on that now.
Security, by that you mean like the sheriffs that have been hired?
Yeah,
Yes.
because one of the complaints I had was from Manchester and the cost of their local police department providing security when it's a small department, with maybe 1 or 2 officers on a shift, and how they were able to do that plus all their regular jobs.
I'm going to suggest we pull down the screen sharing so we can see the committee and your staff as well.
Well, the last thing I did want to touch on for the committee is the Reach Up program. We are forecasting the caseload to continue to decline. And if Katerina could pull up the chart, it just kind of puts that into perspective of what we've been experiencing.
Okay, sorry, I forgot you.
That's okay. That's okay. And so you can see here, notwithstanding the pandemic, we have been seeing the Reach Up caseload from its high in state fiscal year 13 to 21. I mean, it's almost been a 50% reduction, and that continues. And our normal methodology of projecting is a little complicated, just given the dynamic and the economy right now, and the wage growth that we're seeing due to the scarcity of workers. So it is projecting it, but the caseload is projected to continue to decline. It is a very favorable job market right now with wage increases. And so we have booked savings of about $4.6 million as a result of that. And I just wanted to highlight that for the committee. Katerina, I think you can probably pull that down.
So you took the savings. One of the things has to do with our standard of need and the percent we're paying and what the benefit is. Obviously, that benefit's been bolstered up by all the housing assistance that you've been paying to these Reach Up families. But the budget doesn't include any adjustment in terms of this, the overall, just the basic payment.
Yes.
it looks like that House bill could have fairly significant cost impact and probably have an impact on caseload estimates, because the more you exclude and the more you're enhancing those benefits, then the more you're going to have caseload retention as opposed to transition off due to employment. Have you
Yes, and
costed out what that would be?
we were actually just kind of working on that analysis today, and I can just say it is a significant, it could be a.
It's got to be, as I'm looking at
Yeah.
what the,
Yeah.
the increases, and raises the question about how much you want to do through a public assistance approach versus income support approach. But I remember when the caseload maxed out at over 28,000 individuals, families and children, total beneficiaries. So
I actually remember that too, Madam Chair.
I bet you do. Yeah, I bet you do, in terms of what that looked like. Some of that gets into, supporting the child care assistance program and supporting work.
Yes.
So it's asking to revisit some of those fundamental policy issues. But I would imagine that the cost to the program and what it would do to the caseload would be substantial.
And that's our early work on that is indicating that to be the case, for sure. Yeah.
Other questions then of the commissioner or staff?
The other thing I just highlight for the committee, there's no significant changes in OEO, but I did want to just highlight, we, through the governor's climate package, about $45 million is being proposed to go to OEO to double the amount of low-income households' homes we're weatherizing from through 24 through 26. And I just wanted to highlight that for the committee as well, and that's included.
Is that the additional federal money, or are you talking about?
Yeah, that's the an allocation of the ARPA SFR funds.
Yeah.
Yeah.
And
That's it.
also, LIHEAP had a big bump this year too.
Yes, Katerina, do you have that chart so we can highlight that for the committee? Because it is pretty stunning, the amount of funding we have available for the program this year.
One moment, I'll pull it up on the screen.
Sometimes you don't realize you.
So this chart may look familiar to the committee. This is the compilation and funding chart we put together every year. And year 22 is always projection, for some of the caseload and the cost per fuel, and then we reconcile that at the end of the season.
Yeah, but look at 15 to 47.
Yeah. Yes, so you can see here, we're from last year, we had almost 26 million available. Here, this year, we have $52.5 million of funding available for the program, a significant increase due to the federal stimulus for the LIHEAP program. Again, our caseloads are projecting to be fairly stable from last year to this year. A sizable fuel benefit, with an increase in purchasing power, although fuel costs are higher this year, and we'll have to just wait to see what that average price looks like at the end of the season. But a lot of these dollars are one time. We're trying to utilize them to set the program up for next year in terms of like issuing a spring wood benefit. We issue one in the fall, but maybe issue one in the spring as well to help set those families up next year as well, a little earlier for next year, give them increased purchasing power. We're also issuing out a one-time, what we're terming an electric benefit. So I think it's about a $400 payment to each household to help cover the electric cost of running their heating appliance. And so that's not included in this calculation as well. We did an increased wood benefits, normally around $400 per household. It was over $1,000 this past September for households that heat with wood and wood pellets. And so we have been able to, and we are expanding what we provide for a crisis fuel benefit this season as well.
Yeah,
for families.
Madam
yeah,
Chair?
the infusion of so much money in such a short time, but also at some point, when this money is gone or go back to the normal,
It's,
the block grant, it's an enormous amount of assistance going out to many of this, whether we're talking about, the housing assistance that you're doing additional, using the ERAP money to reach up to the LIHEAP, et cetera. And it's, when 2 years from now or whatever it is, it's going to be a very substantial cliff.
yes, and you and I have had some communication regarding the max allotment benefit in the SNAP program too. And,
Yeah.
and that is in place as long as at the federal level, there's
Yeah.
a public health crisis. And, and so that will end at some point. That's been infusing an extra about 5 million a month into the 3 Squares Vermont caseload.
Yeah. Senator Baruth?
Yeah, I realize it's past history, but I was looking at 2009. It's a little complicated to try to figure out from the various entries, but what was it about 2009 that had it up almost to?
It was a great recession. It was probably the era funding.
It was the era.
Yep.
Okay, because I was going to say it's,
Yeah.
amazing that it matched this infusion, but it was a similar
Yeah.
situation.
Mhm, mhm.
Okay, thank you.
Other questions for our witnesses? Well, I guess you have still a lot of work ahead to get your transition to the ERAP and access those dollars and everything else. So I'm sure we'll have more discussion. And committee, and do I see any more questions? Otherwise, I would say we will adjourn our committee work for the day and get ready for more testimony tomorrow. And I guess the first vote we're going to have on the BAA.
I'll be in touch, Sean.
Thank you.
All right. Thank you. And so we'll